So now we will talk about the differences between a basic healthcare unit and a rural healthcare unit. They have three differences. One is in their definition and the services provided at each of them and the duties of the medical officer at these specific localities. Each union council has one BHU which covers about 5,000 to 10,000 people and an area of 20 to 40 kilometers. However, a rural healthcare unit or center is linked with 5 to 10 primary basic healthcare units and covers 50,000 to 1 lakh people and an area of 240 to 400 kilometers. So talking about the services which are provided in the basic healthcare unit, they include maternal child healthcare services, immunization, diarrhea, malaria and acute respiratory infection treatment, health education, family planning and advice on nutrition. So the services which must be provided at a basic health unit are actually the elements of primary health care. Now let us talk about the services which are provided at a rural health care unit. They are quite similar to the services which are provided at basic healthcare, and they include maternal child healthcare services, EPI schedule, treatment of diarrhea, malaria and acute respiratory infections, health education, school health services and improvement of nutritional status. Now talking about the duties at a BHU, they are preventive in terms of immunization, that is EPI, curative in terms of treatment of any disease, that is prevented, and promotion of maternal health care services. Talking about the duties of rural healthcare unit, they are preventive, curative. Apart from this, there are extra duties, that is administrative, medico-legal, referral, as well as diagnostic. Now let us talk about how there should be a control to all the rural healthcare problems. Now, rural healthcare problems can be eliminated if there is provision of clean physical environment to the people by clean watery as well as better sanitary conditions, control of communicable diseases by EPI scheduling and maintaining of that record. Here it is very important not only to provide EPI schedule immunization but to keep a record of that. Then maternal health care as well as child welfare services should be provided. This is actually the most important and pivotal point in establishing primary health care at a local body level. Then provision of primary health care at a BHU, RHU and a tertiary healthcare unit. So I hope now you have a complete understanding about primary health care, about its elements as well as the principles, the differentiation between a basic healthcare unit and a rural healthcare unit, and how we can provide a control to all the rural healthcare problems. Thank you very much for listening.